Hello, my name is Elle and I'm the founder of the SheWellness Academy. One of the most common questions that I get asked in my nursing practice is, am I in menopause or am I in perimenopause? And honestly, women as well as some healthcare professionals use the terms interchangeably, but they are very, very different stages, and it's really important to understand the difference between the two, because then that helps with managing your symptoms as well as planning your healthcare. So in today's video, we're going to look at the differences between perimenopause and menopause. Let's clear it up. So if we think about perimenopause is like the rehearsal for your menopause. It's the bit before your menopause. It's the bit where your ovaries are still functioning, but they might be a little bit more unpredictable. You're having periods, but they're just not regular anymore. Menopause, however, is when you haven't had a period for 12 consecutive months. That's it. No periods for a whole year. Good 12 months. That's menopause. Postmenopause is anything after the 12-month mark. So I usually try and explain to my patients that perimenopause is a bit like the journey towards menopause. The perimenopausal part can last anything from between 4 years and 10 years. And then the final destination is menopause. How do you know what phase you're actually in? Well, you would be in perimenopause if you're finding that your cycles are shorter or longer. So shorter, 21 to 25 days, longer, 35 days plus. Your periods are irregular. You're developing other symptoms like hot flushes, sleep disturbances as well. You're aged typically between 35 and 55 years of age. And you may also find that your periods, sometimes you miss a period, not a whole year's worth, but the odd one or two you skip. So with all of those things that I've just described, it might suggest that you would be in perimenopause, as they're quite common symptoms. You're in menopause if you haven't had any period whatsoever for 12 consecutive months. The age range would be between 45 years to 55, with the average being 51. And you may also find that some of those symptoms that you were experiencing may now have stabilized. You're in menopause. And you're postmenopausal if it's been 12 months or more since your last period, and that your hormones have now established and reached a new baseline. So what's confusing is that women will experience menopausal symptoms during the perimenopause. So menopausal symptoms are things like hot flushes, mood swings or mood changes, sleep disturbances. And we all often associate that with the menopause, but that's actually part of perimenopause. Those symptoms happen 4 to 10 years sometimes before actual menopause. Clinically, menopause is defined and diagnosed as an absence of your periods for 12 consecutive months. So you might be thinking, why does this matter anyway? Aren't the symptoms the same? Well, it does matter for quite a number of different reasons. The first reason is that the treatment options are very different. Remember, earlier on in the video, I said that during perimenopause, your ovaries are still functioning, they're just a little bit more unpredictable, and you might have irregular periods, but you're still having periods, which means that you can still get pregnant. So you need contraception while you are in the perimenopause phase. Also, the hormonal treatments at that point in time are very different too. The symptom management changes as well, because in perimenopause, The symptoms are unpredictable because of the various fluctuations within your hormones, whereas in menopause, things are a lot more stable. The health screening needs change as well because the different health risks and screening recommendations change depending on which phase you're in. And then there are different timeline expectations because if you know that you're in perimenopause, then you know that this is probably going to last for some years rather than expecting for things to last just a few months. I've met some women who think that they're broken because their symptoms keep on changing, but understanding that you're in a long transition phase rather than just a quick thing that's going to be over changes everything. So let's talk about the timeline for an average menopausal journey, because this is normally the part where people become the most confused. So it normally starts off with early perimenopause, and that's the part where there are subtle cycle changes. So your cycle might be shorter or it might be longer. Then we go into late perimenopause, where the changes are a little bit more obvious, such as irregular bleeding. Then we go into menopause transition, which is usually the final 1 to 2 years just before your periods stop completely. Then we go into postmenopause, which is where the symptoms usually stabilize. So what that means in real life is you might start noticing changes in your late 30s, early 40s, but not actually reach or transition into menopause until your 50s. So that's a good 10 years plus of transition. And I want you to know that this is normal. You're not imagining it. You're not broken. And you don't have to suffer in silence or without support. So before we wrap up, let me give you some clinical guidance on when you need to seek medical attention. If you're finding that you're getting heavy bleeding, and we're describing heavy bleeding as completely saturating a tampon or a sanitary towel every hour. If you have bleeding that lasts longer than 7 days, if you're bleeding in between periods, if you start to bleed after you've gone a full 12 months without bleeding and then suddenly start to bleed, and if you've got any symptoms that are significantly impacting your ability to work and your quality of life, all of these things, you must seek medical attention. Don't wait to seek medical attention if the symptoms that you're experiencing are impacting your relationships, affecting work, or just daily life. There are effective treatments that are available. So there we are. The clear definition between perimenopause and menopause, because it's important to understand where you are in that journey. It helps you to make informed decisions about what's available to you and what support you may need. Next week, my video will be on 5 period changes that really do need your attention. It's important again to know what's normal and what isn't normal and what to do. So if you're tracking your symptoms or wondering where you are in this journey, then keeping a simple calendar of your symptoms and your periods and taking that along to your next healthcare appointment can be life-changing. That's your homework. Also, what questions do you have about perimenopause and menopause? Drop them in the comments below, so that helps me to shape the content that I provide, because I want to make sure that it's worthwhile and that it answers the questions that people have. So drop them in the comments below and I will answer every single one of them. I'll make sure of that. So if this was helpful, please give this a thumbs up and subscribe I usually post videos on a Tuesday, so there's good weekly content, and I'll see you next week Tuesday. Thank you very much indeed.
Rise and shine today, feel the light we say, health and joy our way, we're SheWellness.